and maxillary sinuses, temporal pulses, temporal mandibular joint, cranial nerve 5, masseter muscle strength, corneal blink reflex, light touch sensation, cranial nerve 7, symmetry of facial movement.
We're going to start off with your head and face, and the first thing I just want to do is take a look at your face for symmetry, the eyebrows, and I want to palpate your skull and just check the hair for turgor or for texture. Okay. And we're going to palpate the frontal sinuses and the maxillary sinuses. Any tenderness?
No.
Okay. And the temporal pulses, and the TMJ, and I'd like for you to open and close your mouth. Feel for any crepitus. You got a little bit over in there, okay? And we're going to start checking for cranial nerve number 5. I'd like for you to clench your teeth. Good, okay? Cranial nerve 5, we also do a sensory portion of it. The first thing I'd like for you to do is just to close your eyes, and I'm going to touch your face, and every time I do, I want you to say now.
Now. Now. Now. Now. Now. Now. Now.
Okay, keep your eyes closed. Another portion of this exam that we don't do for this particular exam and that most people don't do in their clinical practice is what they call the corneal blink reflex. I'd like for you to open your eyes, and I'll just describe it. What I would do is I would just simply have you sort of tip your head back, okay, and I would have you look up, and then what I would do is I would just simply touch the cornea on each side with a little wisp of cotton looking for a blink. Good. Bring your head level. And we're going to test cranial nerve number 7. First thing I'd like for you to do is to sort of look up towards the ceiling. Okay, and again what I'm looking for is just even wrinkling across the forehead and that the eyebrows are raising symmetrically. Okay, and now we're going to do some funny face stuff. I'd like for you just to close your eyes as tightly as you can. Don't let me open them up. Good job. And then I'd like for you to do some funny faces. I want for you to smile. Show me your teeth. Okay, puff out your cheeks. And pucker up. Good job. Okay, good.
Number 1. Palpation of the sinuses will produce tenderness over the affected sinus in chronic allergies and sinusitis. True tenderness of the sinuses, however, a bruised feeling, should be differentiated from simply a feeling of pressure. Number 2. Cranial nerve 5 has both a sensory and motor portion. The sensory portion is tested by light touch on the face. This tests all 3 divisions of the nerve: ophthalmic, maxillary, and mandibular. The motor portion of the nerve is assessed by palpating the masseter muscles as the person clenches their teeth. Know which neurologic pathway you are testing.
Neck, cervical lymph nodes, supraclavicular and infraclavicular nodes, range of motion, cranial nerve 11, strength testing, palpation of the trachea, thyroid gland.
We're going to continue down the neck, and the first thing I'm going to feel for are some lymph nodes in your neck. First, back here we have the occipital nodes. The tonsillar nodes are right here at the angle of the jaw. The submaxillary nodes are midway between the chin and the angle of the jaw. Submental nodes are right underneath the chin. And right now I think we'll just go ahead and do the preauricular nodes just in front of the ear, the postauricular nodes which are behind the ear, and we'll just continue down and do the posterior cervical nodes behind the sternomastoid, and the anterior cervical nodes in front of the sternomastoid. And we'll do the supraclavicular nodes. I'd like for you just to kind of shrug your shoulders up. Good, and they're right in here. Good, and let your shoulders drop. And we'll do the infraclavicular nodes, which are just below your clavicle. Okay, good. And then what I like for you to do is head straight. And I'm just going to check for the trachea, make sure that it's straight and midline. I put my finger right in the middle. And then I'm going to feel to both sides just to make sure that I've got an even spacing. Okay, good. And we're going to do just a little bit of range of motion before we move on to the thyroid. I'd like for you just to put your chin down on your chest. Put your head all the way back. Okay, let it come even again. Turn your head as far to one side as you possibly can. And we're going to start testing cranial nerve 11. I'd like for you to push against my hand as hard as you can. Turn your head all the way to the other side. Again, testing range of motion, and push against my hand. Again, part of cranial nerve 11. And bring your head straight. I'd like for you to lift your shoulders up against my resistance. Again, cranial nerve 11. All right, we'll move on and finish up the neck by doing the thyroid gland. I need to get a little bit behind you here. Most important thing is to give it some placement. So what I'm going to look for is the suprasternal notch. I'm going to run my finger up until I feel the cricoid. And then my fingers are going right between those two landmarks. Now what I'd like for you to do is just to sort of turn your head to the right. And when you do that, I can get my fingers in front of the sternomastoid. And when you turn your head to the left, I want to make sure my fingers are in front of the sternomastoid. If I get them too far behind, I'll think you have an enlarged thyroid. And then just bring your head straight again. Now what I want you to do is to look just a little bit down towards your left knee. And when you do that, over on this side, your muscles are relaxed. So I'm going to feel with my left hand over here, and I'm going to push to the side with this hand. And I'd like for you to try and swallow for me if you can. Good. And I want you to look down over to your right knee. Again, you're relaxed over on that side, so I'm going to feel with this hand over here and push from the side with this one, and I'd like for you to swallow. Good.
Number 1. When examining the nodes, it is sometimes better to examine one side at a time, concentrating fully on what you are feeling. This is particularly true when palpating for very small nodes. Never sacrifice a quality exam for the sake of efficiency. Number 2. When assessing range of motion of the neck, watch for smooth, even, controlled, and supple movement, not just the range of movement. A head tilt and movement of the shoulders rather than the neck may indicate muscle spasm. Ratchety movement may indicate an arthritis or muscle inflammation.
Eyes, eyebrows and external eye structures. Cranial nerve 2, confrontation, peripheral vision. Cranial nerves 3, 4, and 6, extraocular movements. Corneal light reflex, oblique lighting of cornea and lens. PERRLA, ophthalmoscopic examination.
We're going to continue with your face. First thing I want to do is just take a look at your face. I'm looking at the eye structures and the eyebrows, looking for symmetry, of course. We're going to move on and do some cranial nerve testing, which has to do with the eyes. And the first thing is called confrontation, or cranial nerve number 2, and it tests your peripheral vision. First thing I'd like for you to do is take that hand and put it over your right eye. Okay? I'm going to match you on that side, and I want you always to be looking right at my forehead. All right? And when you see my wiggling fingers come into your field of vision, I want for you to say now.
Okay. Now. Now. Now.
Okay, keep your hand right there. Don't move it. I'm going to change my hands.
Okay.
Again, tell me when you see it coming.
Now. Now. Now.
Good. Okay. Put that hand over the opposite eye.
Okay.
I'm going to match you on the same side. And look at my forehead
Okay.
when you see it coming.
Now. Now. Now.
Keep your hand right there. I change my hands.
Now. Now. Now.
Okay, good. All right, hand down.
Okay.
All right. And we're going to do cranial nerves 3, 4, and 6, or what are called extraocular movements. All right? What I want you to do is just to follow my finger wherever it may go. Keep watching, keep watching, keep watching, keep watching. Okay, good. We're going to do extraocular movements. There are two ways of doing them, and that is for the examiner to make either a star pattern or an H pattern. We've done the star, and I'd like for you just to follow my fingers now wherever they go. We're going to do an H pattern. I want you to keep your head just as still as you possibly can and just follow my finger. And we're looking for any nystagmus or lid lag. Keep watching. All right, good. Okay, next thing we're going to do, continue with your eyes, we're going to do what's called the corneal light reflex, and I can either do this with the light actually shining in your eyes, or I can just use the overhead lighting. I just for you kind of want to tip your chin up a little bit and look up, and I'm just looking to make sure that the overhead lighting is reflecting equally off of both corneas, and it is. Good. Okay, head level, and we're going to look at your eyes with some oblique lighting. Just look straight ahead, and I just want to look across the corneas. Sometimes it's best to do this with the lights off. You can see just a little bit better. I'm looking for any opacities or irregularities across the cornea and across from this side. Okay, and we're also going to test your pupils for equality and reactivity to light. Again, just look straight ahead. And let me do this one again. And also looking for accommodation. All right, good. All right, next thing we're going to do is the ophthalmoscopic exam. And I'm going to start mine at 0 because I've learned to do mine with my glasses on because my correction is so poor. I have to leave my glasses on to do this. Now normally what we do, Teresa, is we would turn off the overhead lighting to give your pupils adequate opportunity to dilate so that I could see better, but since we are filming this, it's a little bit difficult. What I would like for you to do, though, is to focus just as far down the end of the room as you possibly can. Again, that helps your pupils to dilate. And even if I get in front of you, I want you always to concentrate almost on looking through me down at that end of the room. And we'll start over here. I'm going to steady your head just a little bit. All right, and we'll start in at about 15 degrees, and I'm going to catch the red reflex and move in until I catch blood vessels. And when I see the blood vessels, I'm going to follow them in the direction in which they are getting larger. And when I do that, I will pick up the disc and there it is. And we're looking at the edges of the disc. Okay, good. I'll switch around to the other eye. I didn't have to change any diopters on that one because I saw really well. Okay, once again, find that spot right down there at the end of the room. Concentrate on looking at it, even if I get in your way. Okay, and I use the opposite eye this time to look in. Picking up the blood vessels. disc. Okay, good.
Number 1, remember, you, the examiner, must use your right eye to look at the patient's right eye. Your left eye will look at their left eye. This is important if you are to prevent bumping noses. Number 2, place your opposite hand on their forehead. This allows you to orient yourself to your position in space. Without doing this, you may not realize how close you are to the patient. It also prevents the patients backing away from you. Number 3, also remember that focusing is a very individual choice and routine. Just keep in mind that the refractive status of both the patient and you, the examiner, makes a difference in how you go about focusing.
Ears, cranial nerve 8. Hearing, Weber test, Rene test, auricle, pre- and post-auricular nodes, otoscopic examination.
Move on, we're going to do the ears. First thing I want to do is test your hearing. I'd like for you to just take one finger and plug up that ear right there, and I'm going to test this one over here. And I'm going to say some words. Hat, cat, rat. I'd like for you to tell me what I said.
Hat, cat, rat.
Okay. Plug up that ear. All right. How now, Brown?
How now, Brown?
Okay, good. Not only did you hear it, you are able to discriminate between like-sounding sounds. Good. And the next thing we're going to do is something called the Weber test. Do you hear that?
Yes.
Tell me if you hear it in the right ear, the left ear, both ears, the middle.
Oh, it's going away.
Want to do it again?
Do it again, please. I hear it on the right.
On the right? Okay. Let me try it with a little bit higher pitched one. Sometimes it's easier.
Both.
You hear it in both ears. Okay. All right. Next thing we're going to do is called the Rene. Do you hear that?
Yes, I do.
Okay. Tell me when it goes away.
Okay.
Do you still hear it?
Yeah, I still hear it.
Okay. We'll do the other side. Do you hear that? Let me hit it just a little bit harder.
I hear it, yes.
Okay, you tell me when it's gone.
Okay. It's gone. I couldn't hear it.
And you can still hear it?
Yes.
Okay, so I know that air conduction is greater than bone conduction, and that is normal. Okay. All right, we're going to start the ear exam. I already did your pre-auricular nodes and your post-auricular nodes, so we won't do that anymore. And we're going to just inspect the auricle of your ear. Again, looking for any lesions and so on. And I'm going to push on the trachea and pull on the auricle, looking for any otitis externa, which is an infection in the ear canal. We'll do the same thing over here. Again, pushing on the tragus and pulling on the pinna. No tenderness?
None.
All right, we're going to continue with the otoscopic exam. And there are probably as many ways to hold this otoscope as there are examiners in this world. And so everyone sort of learns their own technique. Some people like to hold it this way, which is particularly good if you are examining children in case they should move suddenly. You always have protection so that you don't jab it in their ear. I've tended to learn to use it this way. In an adult, pull the ear up, out, and back. Get it placed first, and then look in. And I'm looking at the tympanic membrane. And it's pearly gray. It's got a sharp cone of light. Landmarks are visible. There's no distortion. Good. We'll turn around to the other side. In a child, you want to pull the pinna down and backwards, and that straightens out the auditory canal. All right. Once again. Looking at the canal, which is clear, and the tympanic membrane, which is pearly gray, a really sharp light reflex, and the landmarks are visible. Looks good. All right, and that finishes the ear exam.
Number 1. When using the otoscope, use the largest possible speculum to improve your vision and the patient's comfort. The speculum is inserted with the greatest amount of pressure being exerted against the anterior wall of the canal. The posterior wall tends to be very sensitive and is therefore uncomfortable when undue pressure is applied. When the speculum is either too small or there is too much movement, the patient will usually experience some discomfort. Number 2. When doing an otoscopic exam, pull the pinna up and back to straighten the canal of an adult. When examining a child, pull the pinna downward to straighten the canal.
Nose, external structure, patency of the nostrils, cranial nerve 1, smell sensation, nasal mucosa, anterior septum, inferior and middle turbinates.
The first thing I always want to look at is just to make sure that the nose is midline the face and that it's straight. I like to test patency. I'd like for you just to sort of plug up one nostril and sort of breathe in through one side. Okay, and then the other side, same thing. Good. Now I'd like for you to do is to close your eyes, and I want you again to plug up one nostril. And I'm just going to put a little something under your nose. I want you to breathe in and tell me what it smells like.
Coffee.
Coffee.
Yeah.
Okay. And the other nostril, plug that one up. And breathe in.
Cinnamon.
Cinnamon, good. Okay, this tests cranial nerve number 1. Okay. All right, and we're going to inspect the nose. There are special speculums that you can use for inspecting the nose. I find, however, that I can get most of the information I need either with just an ear speculum or sometimes just with a plain pen light. What I'd like for you to do is tip your head back, backwards, okay? And again, what I'm looking for is to make sure the septum is straight and midline, and I'm sort of going to tip this back. And with the light, I can look at the anterior septum, the nasal mucosa, and I can see the inferior and the middle turbinates. Again, on the other side, the anterior septum, the nasal mucosa, and again, the inferior and middle turbinates. Good, and that finishes the exam of the nose.
Mouth and pharynx, lips, buccal mucosa, teeth and gums, parotid ducts, tongue, salivary glands, salivary duct openings, hard and soft palate, anterior pillars, posterior pillars, and tonsils. Cranial nerves 9 and 10, rise of soft palate and uvula, gag reflex. Cranial nerve 12, tongue for fasciculation, asymmetry, or deviations.
Next thing I want to do is just look at the mouth. I want to just take a look at the lips, looking again for symmetry and making sure there are no lesions. I'm going to have you open your mouth. And I want to look at the teeth and the gums and the buccal mucosa, looking at the parotid glands, which are little tiny slits right back there on each cheek. Okay. And I like to look at the Just stick your tongue out a little bit, look at the top of the tongue and the sides of the tongue, and lift your tongue up, and up. Lift it up, curl it up. There you go. Okay, I'm looking at the salivary glands, the duct openings, and the bottom of the mouth. Okay, I'd like for you just to swallow. I'm going to have you open your mouth again. All right, and we're looking back at the soft palate and the hard palate, the anterior and posterior pillars and the tonsils and the posterior pharynx. And I'd like for you to say ah. I'm looking to see if the uvula rises in the midline. At this point, I could gag her. This would test cranial nerves 9 and 10. I want you to stick out your tongue. I'm looking for any asymmetry, deviations, or fasciculations of the tongue, and that tests cranial nerve number 12. Good. Close your mouth. And that finishes the exam of the mouth.
Posterior thorax.